Welcome back. The Health Secretary, Wes Streeting, told us earlier that obesity costs the NHS £11 billion a year and that he wanted supermarkets to sell more fruit and vegetables instead of sugary treats. This week, he'll publish a 10-year plan for the NHS. The General Secretary of the Royal College of Nursing, Professor Nicola Ranger, joins me now. Can we just first talk about my diet? What do you make of this idea that Wes Streeting is going to take 100 calories out of my shopping basket?
I think, sadly, we're probably focusing on slightly the wrong area with regards to how do we get people to live healthier lives. And that starts at school-age children. That starts with really quite personal conversations. And the best place to do that in someone's home and children at school. But in reality, we've reduced the number of nurses and health visitors and school children nurses for school children by 45% since 2009. And this government talks a lot about prevention. But before we get to supermarket baskets, maybe we should try and increase the number of nurses that are really in a good place for that prevention conversation.
So you would say that priorities aren't quite in the right place?
I think trying to control the symptom is more challenging than getting to the root of the challenge and the problem. And we would love to see investment in nursing because they are a profession in the right place to be able to have those very sensitive conversations with the public and children. And we think we'd like to see that erosion of those posts invested in.
The Prime Minister, Health Secretary and the Chancellor all say that investment in the NHS has to be accompanied by reform. And the new boss of the NHS, Jim Mackey, said, I'm quoting here, that the service has built mechanisms to keep the public away because it's an inconvenience, and that's what's got to be reformed. Is there any truth in that, do you think?
I think, sadly, there is. I think that when this government first came into post, I think many of us, I was working, just left the health service at the time, were pleased that the Darzi report gave a very good diagnosis about what was wrong with the NHS. Really challenging performance, which those working in the health service could see and feel. This 10-year plan is really important as the treatment plan after the diagnosis of what's wrong. And I think, sadly, many people working in the health service are not always proud of the care that they're giving. We really pushed forward a corridor care report in January. Many nurses not proud of the care they were giving because they felt that patients weren't at the centre. So I think, sadly, there will be many NHS staff that will recognise what Sir Jim Mackey is saying and are desperate to put it right.
But there's going to have to be some quite dramatic change. You mentioned Lord Darzi's report, and I'm quoting these numbers from memory, but I think Darzi said that the NHS over a recent period has acquired 17% more staff, but productivity had declined by over 11%. That means that people in the NHS are going to have to do some things rather dramatically different.
I think when you look at that figure, what's not also accompanied with that is how many patients are in the wrong place in hospitals, far too many patients in corridors, in A&E, and at least in some, I've been to some hospitals with 5 extra patients per ward. How can you possibly run an efficient and brilliant service when you're completely stretched with how you're trying to function? I've met patients that have been sitting in a chair for 72 hours. So this is the environment in which we're trying to be incredibly efficient and productive. It's just not possible. 30% of patients that are in hospital settings need to be cared for at home. In reality, there's been a reduction in district nurses and the number of nurses in social care has reduced by 17,000 since 2012, at the time when health has got more complex. So there is something around, if you want to be productive, we've got to get more patients out of hospital. And I fully support, the college fully supports the government's left shift into prevention and community care. But that's not going to happen unless there's some pump priming and investment in community. And then that way, hospitals will be more efficient.
One of the ways in which I think it's being suggested by the Health Secretary that you might make some changes, aside from the 29 billion that the Chancellor put in the spending review is that there could be a performance-related investment. That's to say, if patients say that hospital that they've been to is a good one, and it's dealt with them well, then that hospital will get more money. I suppose by converse, those who get a bad TripAdvisor recommendation perhaps don't get as much money. Is that the right way to go about this, or does that create perverse incentives?
It can create perverse incentives. We've seen that in the past. And actually, for us, we would like to see that reform focus on the largest professional group in the NHS, which is nurses, who got the lowest public sector pay award this year and have done for decades. And actually, we are weighted to the bottom of the NHS pay scale.
Does that mean you want a big chunk of that 29 billion to come into nurses' pockets?
We expect our value to be completely understood and invested in. We are the 24/7 presence for patients. If we're not brilliant, patients come to harm. And actually, nurses are weighted to the bottom of the pay scale. They are the least paid. And in the government's own report, the Darzi report, nurses gave the most free hours. So we are not being greedy, we expect to be valued. And a recent poll of the public, 75% said that they believe that nurses should be paid more for what they do, and 66% said they believe this government doesn't value nursing. Now, we can see that this government does care about the NHS. We want to support that. But the key to success is valuing nursing, which we do not currently see.
Nicola Ranger, thank you for your time this morning.
Thank you so much.